is not appropriate. And this is where I come in. Hi, I'm Collins, a pharmacist at the drug manufacturing unit.
Relations unit of the hospital. This afternoon is a turn of the pharmacy department or pharmacy directorate to also have their turn to talk to our valued listeners and then our in-person audience here. And then today we have something very, very interesting. I mean, with pharmacists, the notion around is the pharmacists are dispensers of medicines. We just pick what is on the shelf and give to patients. But this afternoon, after our interaction, I think that notion will be dispelled and we'll get to know more about what the pharmacist does beyond just dispensing. So our take-home message, if not anything at all, is that beyond dispensing, the pharmacist does more. So I'll give a brief history, who we are and how we have arrived here. In medieval times or ancient times, historic times, the pharmacist, what we refer to now as the pharmacist, was called the apothecary. That was the description. And he is known as the original pharmacist. And the role of the apothecary was he had a multi-skilled role where they prepare potions or medicinal potions, where they diagnose, and also where they treat the patients as well. So the medieval original pharmacist or the apothecary was playing this role as more or less the first call practitioner when it comes to healthcare. And this happened between the 13th to 19th century. Most people relate pharmacists to those who work in community pharmacies. Most people relate pharmacists to those who work in community pharmacies. Some even call it, lay people say drugstore, drugstore. But this afternoon, we want to dispel those notions and tell you more about who we are, what we do. As our roles have expanded into clinical services, the pharmacist now is a key personnel, a key component of the healthcare delivery, which has now assumed or adopted a multidisciplinary approach, where we have the prescriber or the doctor, we have the pharmacist, the nurse, we have the physiotherapist, the nutritionist, the biomedical scientist, and all that. So we'll tell you more about the key role, crucial role that the pharmacist brings on board to this multidisciplinary approach in patient healthcare. So to start the presentation or education, I have my able panelists by me. I'll introduce them. I have Dr. Angela Hatchful. She's a pharmacist at the emergency medicine section and also a senior resident who is specializing in that field. Seated by her is Collins Opon. He's I refer to him as he's at a compounding section or manufacturing unit, as we call it here. And I refer to him as, from the little history I gave with the original pharmacist or the apothecary, I refer to Collins Opon as the Pro Max apothecary. When we use these gadgets, electrical gadgets, we have the Pro Max and all new versions, because our foundation as pharmacists is the dispensary. And we've evolved from there, and we have expansive services now where we contribute to patient-centered care. So Collins Opon from the drug compounding or manufacturing unit is our Pro Max apothecary. So he also tells us the brain or the engineering, the architecture behind tailor-measured or personalized formulations for special populations who cannot maybe take adult medications, or for adults for some reason who cannot take their prescribed dosage forms, and then we have to tailor make their preparations for them. So without wasting time, I'll call on our first presenter or panel, Mrs. Angela Hatchful, emergency pharmacist, to do us honors and tell us more about the evolved role of the pharmacist. Thank you very much.
Good afternoon, everyone. I'm very privileged to do this presentation on behalf of the pharmacy department. Like he rightly introduced me, my name is Dr. Pharm Angela Hatchful. And the topic for our discussion this afternoon is from the dispensary to the patient, the pharmacist's touch. So I'll take you through a brief introduction. We'll talk about the rational use of drugs, through to why we chose the topic, and then we'll conclude and then give some acknowledgement. All right, so to take up from where he started, who are we? So I would say a hospital pharmacist is a clinically trained pharmacist who works inside a hospital as part of the multidisciplinary team focusing on good quality, safe, effective, and cost-effective use of medicines and medical aids or devices. Here I'm talking about spacers, stockings, inhalers for inpatients, outpatients, and also we take part in emergency cases considering age appropriateness of the services that we render. What are some of the services that we render as pharmacists? First on the list and the topmost is the review of medication order. And these are the orders that the doctors would write down for a patient. It will interest you to note that every patient that comes to the hospital, about 90 to 95% of patients who come to the hospital for care are always given medicines. Very few are taken care of without medication. And so the communication between the doctor and the patient is through the pharmacist by way of a medication order, which we call the prescription. And so that's the topmost that we do. We review medications and then ensure that the patient receives them timely. We also participate in ward rounds, which is one of the things that we have come to take up as hospital pharmacists, not just stuck in the dispensary, but we go onto the wards to participate in ward rounds. We also prepare and dispense medications when the need arises, especially when it comes to the reconstitution of extempore medications like the syrups that children have to take that are not very stable. Sometimes right at the spur of the moment when the patient needs it, reconstitution is done, and that is done by the pharmacists in the dispensary. We also monitor patients' responses to therapy. Once you are given the medication, it is our duty to ensure that you are responding to the medication that you are being given, whether positively or negatively. And then we work on it in tandem with the clinicians and then the patient. We also provide drug information and public education like we are doing right now. For every medicine that we give out, we ensure that you know something about the medicine you are taking so that at the end of the day, you will benefit from it. We also counsel patients and caregivers. Once we're giving you a product, we need to let you know how you would use it, why you will use it. And also, if you are not in the position to be able to do it yourself, we talk to the caregivers so that whilst you're on admission or when you go home, you'll be able to benefit most from the medicines we give. We also perform medicine reconciliation. I'll talk more about it as we go along. We also detect, we document, and manage adverse drug reactions. Like I mentioned, when we give out the medicines, we follow up to get your responses. Sometimes there may be tolerable side effects, sometimes there may be intolerable side effects. And when that happens, we are able to detect in tandem with the patient or the relatives, and then we document them and manage them accordingly. It will interest you to know that as part of our portfolio, we run and support some disease management clinics as well. Talk about the HIV clinic, the TB clinic, and we're also heavily involved in antimicrobial stewardship. We manage medicine procurement, storage, and inventory. That is also under our domain. We supervise and oversee safe storage conditions, expiry management, and controlled substances. Talk about opioids. We do not just give them out, but it goes through certain schedule and protocols before we give them out. And that is what we are talking about here when it comes to controlled substances, their supervision, and then their safe storage. We also contribute to hospital policies and formularies, things that will benefit the healthcare workers, things that will benefit our patients. And then, of course, when guidelines are being developed, you would see the pharmacist at the table. We also support training of students, interns, residents, and other staff. Of course, Korle Teaching Hospital, and so we are involved in the teaching and training of these people. We also participate in research and quality improvement projects. I would want to talk more about the rational use of medicines. Medicines. We are the experts on medicines, and so whenever medicines are mentioned or wherever you find medicines, you are sure to find a pharmacist. So medicines are prescribed for you and you alone as a patient when you come to the hospital, and we ensure that it is tailor-made. It is for you and it is best suited for you. So we personalize it for your condition, considering a lot of things as the doctor is able to diagnose and then the labs are able to point out. We ensure that we choose the right medicine which is personalized for your use. So the caution here is do right medicine to the right patient. So we identify the right patient. Then, of course, we give you the right medication that is suited for the problem or the health need that you have. Of course, you may have varied indications. We also make sure that the indication is right and that the medicine will identify and then help you out when it comes to the use of the medication. At the right dose, going through the right route, whether it is IV, oral, or topical. We also want to ensure that you're using it timeously. If it is once a day, twice a day, it's a start dose, or you have to take it for a period of time, we are concerned about the duration as well. So the right patient, right medicine, indication, dose, route, frequency, and duration are things that we don't compromise about. Talk about polypharmacy. One patient is likely to have more than one medicine at a time. What should the patient do? The patient will have questions, and so it is our duty to ensure that the patient understands why he's taking 2 or 3 medicines at the same time. And once they understand this, I believe that compliance, that is, they taking their medicines the same way they are asked to take it and for the period, will be better than without understanding. Our topic says beyond the dispensary. So what happens when you are giving your medication? It's the pharmacist's duty to ensure that after the good dispensing practices have been done, that is where we validate and audit the prescription and ensure that it is right. We go on to label and give the right instructions that go along with the medication, whether you're an inpatient or an outpatient. We also ensure proper handling and use of the medicines and devices. If we need to take you through how to use an inhaler, how to put on a stockings, we'll do that for you. Ultimately, the care, we call it the pharmaceutical care. When we talk about pharmaceutical care, which is what we do mostly as hospital pharmacists, is a responsible provision of patient-centered care, taking into consideration a lot of things that at the end of it, the patient is able to achieve specific outcomes depending on why the patient is in the hospital. And not just that, but goes away with the total well-being having been taken care of. So that is the pharmaceutical touch we bring to the table. In doing so, we also ensure effectiveness of the medicines and cost effectiveness to the patient and the relatives. And so we do what we call interventions. We identify care issues and then we recommend interventions to the doctors and other healthcare workers so that at the end of the day, the patients will benefit from the care that we give. Not only that, but we also handle feedbacks and documentation. If a patient complains about side effects or adverse drug reactions, we are there to take this and then report it accordingly. We also do what we call medicine reconciliation, and this can be done whilst the patient is on admission or whilst the patient is being discharged. And we do this particularly to minimize medication error. We are all about the safety of our patients, and we do not want to harm the patient. As one of the old men says, first do no harm. So I want to encourage, never leave the hospital without interacting with a pharmacist. It will interest you to note that in the hospital, Korle Teaching Hospital, we have over 20 satellite pharmacies. Every clinical department in the hospital is sure to have a pharmacy attached. Name them: medical, surgical, A&E, child health department, ONG, the 24-hour pharmacy, diabetic center, eye center. Every one of these departments and centers has pharmacies attached to them. Why does decentralization? It is for us to ensure that as a patient, you're not stressed, but then you're able to go to the pharmacy nearest you to get the care that you need. Aside these, we also have some specialized pharmacists have moved beyond the traditional role and have added on to our portfolio, being more patient-centered without compromising on our core value, and that is the dispensing. That we can never run away from. So we would see us at the patient is on admission, probably with a chronic condition. The patient may be taking 3, 4, 5, 6, or even 7 medicines, or more than that. What is our role? When the patient is on admission, the doctor might prescribe new medicines. What do we do? So we try to reconcile the medicines you are bringing from outside, from your home, from the referral point, to ensure that there are no duplications. If you were prior to admission hypertensive and so you were on a hypertensive medication, when you come on admission for probably stroke or trauma, we ensure that you continue on your medication, ensuring that the right doses are maintained. If the doctor wants to increase them, we are sure to ensure that the reconciliation is done so that your new prescription would be able to align with your needs currently when you are on admission at the hospital. If there's a need for dose adjustments, we are there. Maybe you were taking 1 tablet or 2 tablets earlier. If it's been increased, we'll ensure that that is 1 tablet or 2 tablets earlier. If it's been increased, we'll ensure that that is done for you. If it's been halved, we are sure to work accordingly, counseling the patient. If it's been halved, we are sure to work accordingly, counseling the patient regularly. And so whilst your medications are being reviewed, they might be stopped or they might be changed. And so what's the point giving you 3 days, 5 days when you have to come back and work out a refund? Or maybe you bring the medicines back and they're not safe for us to reuse on another patient. It becomes a cost to you. Safe for us to reuse on another patient. It becomes a cost to you. We are there to ensure that cost effectiveness is achieved. We also give you information about complex side effects and also give you options. We don't compromise on quality, but we have varied medicines available in different forms and different brands that are cool on your pocket, and if you can afford, we'll give you what your pocket can give you. We ensure safety and continuity of care regardless. There's special counseling that comes with the medication anytime there's a change of medication. Like I mentioned, we also are involved in economies, so we are into cost saving when we do our medicine reconciliation to make sure that you do not have many medicines than you need at a particular point in time. And then, of course, one of our pharmacy units also has a credit facility available. And so for there, when you come in, regardless of whether you have the ability to pay, we'll save the life first, and the documentation can be done later. As part of the touch that we give, we also receive feedback and reporting.
The administration, where the staff also, they give us support when it comes to the operational work that we also do. So thank you very much. So now I take this opportunity to introduce our next speaker. And then as I introduce, when I gave the short history, he's our compounding pharmacist. He's the deputy head of the drug manufacturing unit or the compounding unit. So, I mean, that used to be our sole traditional role. And so let's give it up for him.
So what is the problem? There is a problem, and what is the problem? So the problem is many commercially available medications are manufactured ready to use with limited dosage forms and limited strength. Which most of the commercial side of business, manufacturers want to do an oral solid dosage form which is targeted at adults, leaving out pediatrics or children. So because of these problems I've just highlighted, you have little Belinda, who is 3 years old. She has a particular medical condition that requires her to take an oral liquid dosage form. But unfortunately, the dosage form on the market is an oral solid dosage form. So we can see from the look of her face, she's not happy at all. Neither is her mama. And the situation is not peculiar to her. It applies to the elderly who at a certain age have a condition called dysphagia, which is difficulty in swallowing, and then also veterinary, that's domestic animals. But I have good news, and the good news is no other healthcare professional has studied chemical compatibilities and can prepare dosage forms to the degree that the pharmacist has. So the pharmacist is an expert in medications. So then how can we help? So the pharmacist can convert the tablet or the capsule into liquid to ensure medication adherence. The pharmacist can also compound topical creams as and when it's needed. And then the pharmacist can make medications that are not available due to manufacturing shortages. So in the photograph, you can see little Belinda and her mama coming to the pharmacist because they've heard the pharmacist can help them. But before we get to how we can assist, I would like to touch on how drug manufacturing comes into play, what we do at drug manufacturing unit. So as part of our core functions, we provide compounding and small-scale manufacturing of essential medicines. We also provide training and support services to tertiary and other health institutions in the area of drug compounding. And last but not the least, we perform research geared towards development of formulae for pharmaceutical preparations and improvement on the quality of products formulated. So how is it done? How do we do it? It's done by what we technically call compounding. But in the layman's English, I would say customization. And it starts with a prescriber, a patient, and then a pharmacist. So we have what we call the patient triangle, being the prescriber, the patient, and then the pharmacist. So traditionally, the prescriber would want a particular dosage for mostly for pediatrics and oral liquid formulation for their patient, which is readily not available. So then the doctor would write a prescription and then ask the patient to come to the drug manufacturing unit for us to do the compounding for the patient. So by way of definition, compounding is an art and it's also a science of preparing personalized medications for patients according to a physician's prescription. It's very important in order to achieve a more positive therapeutic outcome. So why do we need compounding in the hospital? I think I've mentioned quite a little about it. So fewer commercially manufactured products for children. There are drug shortages, the need for patient-specific dosing, then the specific fluid requirements, and then some products have short stability, so it doesn't make commercial sense for a manufacturer to do it. So then it comes to our end, and with the knowledge of stability and all, we will do a preparation for about a week or 2 weeks per reference standards. So in our picture, we can see a medical doctor in her suit. She's happy to come to the pharmacist, and we can see little Belinda also there, ready for her medication to be customized for her. So we come to the customization process. That is the compounding process. It starts off by the pharmacist screening the prescription. So the prescription comes in, we check the name of the patient, the age, we check the drug, the dose. So we do everything that a clinical pharmacist will do to ensure that the drug is appropriate for the patient. After we are satisfied with the first step, we go on to do our calculations. And this is a very important step in drug compounding because any mistake in calculations will mean a life is at stake. So what we do is very important, and the calculation bit is very, very important. So the precision and accuracy is very key at this step, and we don't compromise on it at the drug manufacturing unit. We have different points of checks to make sure that whatever we've compounded is calculated accordingly. So once we are done with the calculations, we move on to do the titration, which is basically the breaking down of the tablet into powder form using your mortar and your pestle. Then we add the additional excipients that we need to make the product palatable for little Belinda to take. So once we are done with the compounding, we bottle it, we label accordingly, stating the name of the product, the dose per volume, we state the patient's name, we give directions as to how it should be taken, all written on the label, and we give the shelf life on the label. And then we go, documentation is important. So after preparing it, we document in our compounding logbook, and then we go off to dispense to the patient. And in dispensing, we counsel the patient on how to take the medicine and how to store it. So in your picture, it's clear the pharmacist working on little Belinda's preparation. So the recovery, after the pharmacist has done the compounded formulation, little Belinda has taken her medicine, and we can see from the picture, she's happy, the doctor is happy, and the pharmacist is happy. So what did the pharmacist do? So the pharmacist prepared a medication that is safe and efficacious. The pharmacist prepared a dosage form that is palatable and easy to administer to the patient. So I'll highlight our product portfolio at the drug manufacturing units, where we are making a difference. So when it comes to the extemporaneous compounding, we do hydroxyurea, which forms about 60 to 70% of our extemporaneously compounded preparations. It's levetiracetam, we do risperidone, clonazepam, baclofen, etc. And then when it comes to the small-scale manufacturing aspect, we have the non-sterile products, and then we have the sterile products. So like you see, the non-sterile products, we have spironolactone or aldactone, furosemide, all are in-house developed products. We developed the master formula ourselves as per one of our core functions, which is to do research. So we develop the formulas ourselves, and our patients are doing well on them. And then we have the sterile products, 3% hypertonic saline. For a long time, no manufacturer was producing 3% hypertonic saline. It was, I think, just recently that Atlantic Pharmaceutical Sciences, Life Sciences, started producing. So we've held the back of most doctors when it comes to that area, 3% hypertonic saline. Lately, there is a general shortage of 10% dextrose in 1/5 normal saline. And manufacturing units, we are at it producing for the hospital. So to conclude, I'll say compounded medications are an important piece of the patient care puzzle. For some adult patients and children with special healthcare needs and their caregivers, a pharmacist and his or her team offers them hope. Thank you. These are my acknowledgements, and then this is a QR code to the location of drug manufacturing unit. Surprisingly, most people in Korle permanent staff don't even know we exist, let alone where we are. So please, if you are online, you can scan the QR code so that anytime you want to come to the drug manufacturing unit, it will bring you there straight up. Thank you.
Okay, thank you very much, Farm Collins Upon. His presentation takes us back to the original pharmacists, the medieval pharmacists, the critical role in compounding, and then as he illustrated with some graphics, we could all see what he used dressmaking. So we refer to it as a tailor-made touch, where a child or pediatric, age-wise, or that special adult who has been prescribed a tablet or capsule but cannot swallow. But when you get to the original pharmacies, the apothecary Promax, the compounding unit, they can make what? The dosage form that will require, which will be safe, efficacious, and then you can use whichever category that you belong to. So once again, as a reminder, we are live on Facebook, YouTube. This is the Korle webinar series, August edition, and then being sponsored by the Korle Teaching Hospital Management, and then organized by the Public Relations Unit. You can send your questions, comments, or contributions through our social media handles as well, and we read them, and then we address them appropriately. So as he said, we are trying to dispel the notion that one size fits all. commercially made medications are always available, but does it mean that all our patients can take them? But Korle, our compounding pharmacists, has shown us that even though commercially available medicines are commercially made medicines are readily available, it's not every patient who can take them. So the pharmacist can do what? Can customize or individualize your dosage form. As I explained earlier, either you're supposed to take a syrup, either you're supposed to take a mixture, either an ointment and all that. So thank you very much once again, Korle Sopong. We open the floor now for questions, contributions. So our valued audience online on our socials, you can come in with the questions and contribution and comments. So I have a few comments here. So let me take them. Okay, so the first comment is, this is an excellent presentation. That's from Aksana Kokwe. We have Dr. Daniel Ankra. He's saying, well done, pharmacy. I mean, you're welcome with that. Another comment here says that lots of education in this presentation. Well done and thank you. Okay, so I take the last two comments. So very interesting, following from my corner. Okay, so this person doesn't put a name. There's just the social handles. He's very interesting. He's following from one corner. Okay, you're welcome. We thank you. And then the next one says, well done, my pharmacist. So well done, our compounding pharmacist, Apothecary Promax. Well done. Thank you very much. So the floor is open now for questions, contributions. Our audience online, you may send in to our social media handles, YouTube, Facebook. And once more, there's a reminder that this is the August edition of the Kolebu webinar series. And today, Pharmacy Department, Pharmacy Directorate is talking that beyond dispensing, what does the pharmacist do? We've seen that the pharmacist doesn't just pick what is available and dispense, but we do what? We create and then customize or okay, so we take a question from one of the audience.
Work, and what assurance do you have in terms of work, and what assurance do you have in terms of the quality
of pharmacy practice?
The quality
of pharmacy practice. So you know, there is the manufacturing. Yes, just that we have guidelines that guides us in what we do. So there is a USP 795, which talks about non-sterile compounded preparations. There is a USP 797, which talks about the sterile compounded preparations. There is a USP 800, which talks about hazardous drugs. And for us at the drug manufacturing unit, we've been trained and we have our SOPs, which we go by. There are reference manuals that we use, published works that we use. So be rest assured, we are very professional.
In response to this. So as we still await the questions, I mean, from the presentations which were done, I mean, I'll engage my panelists here. So I'll start with Angela Hatchful. You spoke or you highlighted the main theme for our program today, from the dispensary to the patient, the pharmacist's touch, the care behind the cure. Okay, so usually we do get questions, I mean, from people. It could be family, it could be friends. It comes from all over. I mean, people who are not part of us, who are not experts or, I mean, technical people like us. So let me be very specific. I mean, you are home, one of your relatives, it could be your auntie, your uncle, your brother has got an infection. It could be a boil or whatever. Prescribe antibiotics. So the question that we usually people want to find out, I'm having this condition. My family member had a similar one some time back. Why can't I just take antibiotics which were given to my family, my relation, or my friend who had this similar condition? So, Angela Hatchful, I mean, why can't just, I mean, it mimics everything, it shows everything, it's very similar, the appearance and all that. And you know, maybe this is, the bottom line is an infection. Why can't the individual or the patient in this case Why can't the person just take an antibiotic which was prescribed for somebody he or she knows proud to? What do you have to say about that?
All right, thank you very much for the question. It's something that goes on a lot in our communities, but we should bear in mind that medicines are potential poisons. And we may be human beings, all right, but we are not of the same makeup in the essence of age-wise, and then some comorbid conditions that we may have, meaning that you may be somebody who has a chronic condition or may have an impairment in one of the organs of the body, and so not every medicine is suited for you. It might look similar to protect what we have. And I'll even question why your relative still has some medicine with him or her, because the pharmacist will actually assess or audit the prescription and give you exactly what you need, counting the number of medicines that you need for the entire duration you need. So that means that probably that relative did not complete the medication. Regardless, you are a total individual that is separate from your relative. Go to the pharmacist, go to the clinician, seek expert care, and let them go ahead and give you the medicine that is best suited for you so that we can avoid what we call antimicrobial resistance. And of course, medicines that are good for somebody might be harmful for another person based on their specific individual makeup. So I would rather say that go to the hospital or speak to your pharmacist and get the clinicians to help you with your problem. Thank you.
Okay, thank you very much. So, thank you very much. Thank you very much. I think she's done justice to this inquiry, and we do get this a lot. If you're a pharmacist, somebody will tell you. Somebody might even screenshot a skin condition and tell you that a friend had a similar thing. Can't I go and also buy this medication? So she's done justice. She's educated us very well on that. So before we go on, I think protocol, we missed something. I'd like to acknowledge the presence of the core management senior members of the Pharmacy Directorate. Our Director of Pharmacy, Dr. Charles Ofepa, is not available with us. I mean, he's far away somewhere. He's also attending something important. In his stead, we have our Deputy Director for Administration, Pharm Nathan Kumsin, who is also serving as the Acting Director of Pharmacy. Can we acknowledge him? Okay, so next to him, we have another Deputy Director in charge of clinical pharmacy services, and he's in the person of Dr. Pharm Sheikh Ibn Sana. Can we acknowledge? Okay, next to Dr. Sana, we have Pharm Dr. Spoku Boateng, who is in charge of the pharmacy units at the cardiothoracic section. Followed by him, we have our consultant pharmacist, Pharm Dr. Justice Dobe, popularly known as Papa J. So thank you for joining us. Thank you for joining us. Okay, so as we still a reminder for our valuable audience online on our socials. This is the August edition of the Korle webinar series. Today is the 10th of pharmacy, and our topic today is from the dispensary to the patient, the pharmacist's touch. So beyond picking and giving the medication to the patient, today we dispel the notion that pharmacy or pharmacist, we just don't dispense medications. There's a lot more. We've expanded our services, a lot of clinical services that we do. So we are core, a valuable, or a key member of the healthcare team. As I introduced earlier, I mean, it's a multidisciplinary approach, so we need all the expertise on board, and the patient is our focus. The well-being, the safety, and then the positive therapeutic outcome of the patient is our focus. Also, I would like to also say that beyond that, we've seen that the original pharmacist who was only into formulation, preparation, diagnosing, and treatment has evolved now. So now we have the compounding pharmacist. And then with the advent of technology, as Pharm Collins was presenting, you could see that, I mean, he's an upgrade of the apothecary. That's why I call him the Pro Max apothecary, the original pharmacist. The dispensary or the pharmacy is our foundation, but our practice and our services has evolved over time. Okay, so as we still await comments or questions. Okay, I think this. Let me pick.
Okay. Okay, so my question, my questions are in two folds, one for each person. Yes. So to Farm Angie, why would you advise a pharmacist to still counsel any healthcare professional on his or her medications, especially when the person comes to a community pharmacy or the hospital with a prescription? And then the second, what's the relevance? And then to farm upon, you know, when we're young, our mothers would put the tablet on a spoon and then try to add water and then give it to us to take. What are some of the risks in doing taking on these practices? Is there any at all? And why would you want to advise against or not? Thank you.
Okay, thank you very much. Evelyn, she is one of us. Thank you for your inquiry. So she had a question, one each for our panelists. So I don't know who would like to go first. Okay, ladies first. So Dr. Angie Hatchful, I think we'd like you to address her first question, which was directed towards you.
All right, thank you. We all know that every manufacturer will add some instruction to what they manufacture or produce. We as pharmacists are the medicines experts. We know so much about the medicines that have been asked of you to make or to take. And so it is in our interest and your interest that we all understand each other and are on the same page when it comes to your medication. And that is why we have this special feature that is the counseling we do as pharmacists. We need to let you understand why you are taking the medication and for what purpose. Because understanding is very basic for everything we do. Of course, the Bible says that by lack of knowledge, my people perish. If you do not understand why you are doing something, you may not appreciate and do it very well. I mentioned earlier that medicines are potential poisons. The difference is about the dose that you take, which is usually, in our instance, therapeutic, meaning that it will give you the desired effect for which the medicine was made. Of course, for medicines, we have our main effect and we have side effects. Some are tolerable, some are intolerable. Some like taking, back in the day when we had chloroquine, it's to treat malaria, all right, but then it comes with bitter taste, aftertaste in your mouth, and it comes with terrible itch. If I do not tell you about this in a way of counseling, you may not appreciate and understand why you need to follow through with your medication. So whether you are a health professional or you're a lay person, it is my duty to let you know what you are taking first of all, why you are taking it, when you have to take it, how long you have to take it, and what to expect. Some people get scared after experiencing some side effects, which could even resolve by itself without you taking anything. Sometimes, too, you may need to take something else to be able to mitigate the side effect, because we need the main effect regardless. But if I do not tell you, you may be scared and stop taking the medication altogether. If it's an antibiotic, it could lead to antimicrobial resistance. If there's any regular medication too, you will not benefit from it, and then the medicine will go waste. It will be a cost to you, and then, of course, even the disposal might be a challenge. So it is very important that after taking your medication from a pharmacist, ask questions and be patient. Just like you were patient to see the doctor, go for your lab results and all that. Spend a few more minutes to listen to the pharmacist, because we are giving you life-saving information that will benefit you rather than put your life at risk. Thank you.
Okay, thank you very much, Dr. Angela Hatchful. I'd like to also quickly pass that our director, Dr. Charles of far away in Canada for a conference, has joined us live. So, Director, we are doing honors for you, and then everything is going on very, very well. Thank you for joining us as well. Okay, so before Farm Collins upon comes in, there are some comments from valuable audience online. So let me read some of the comments. Some are very interesting. So the first one here says, goes like, okay, I think this is a question. So he says, why are some medicines taken before, after meals? So why are some medicine taken before, after meals? So Angela, I think this one will come to you. So note it down. The next one is, I never knew, I think this is a comment. I never knew drug production exists in Korle Bu, but today I think the education, the sensitization has made everybody aware that we have a drug compounding unit or manufacturing unit in Korle Bu. All right, thank you for your comment. Okay, the next one says, why are some medicines Oh, sorry. Okay, the next one says, thank you for the presentation and exposure. And then the last question, there's a question here, is that, please, this is an interesting one, so let's all listen. And it's very practical. We face it, we encounter it, or we hear it. It says that, please, what is the myth of blood pressure medications making people impotent? So here, I mean specifically with males, adult males. You are taking medication to bring down your blood pressure, and at the same time, you realize that there's a defect somewhere. You understand? There's a defect somewhere. So, I mean, this participant or this valuable online audience is asking us that he wants to know whether this is a myth or in actual fact, I mean, this is what happens. So I think these two are very, very clinical. So I'll hand over to Farm Dr. Hatchfield quickly. So what's your take on the two of them? Why are some medications taken before or after meals? And the myth about blood pressure medications making men impotent or causing erectile dysfunction. Thank you.
That's a very wonderful and insightful question. And I believe the answer to it will help us a whole lot. When we take our medication, there are some processes that the medicine goes through. We have what we call the absorption. We have what we call distribution. We have what we call metabolism and what we call excretion. So when we take the medication, there's one part that is very important that has to do with the absorption of the food, of the medication, which sometimes could be affected by the food that we take. Some medicines do better with the absorption in the absence of food in the stomach. Some do better in the presence of food. And even with the type of food matters. Sometimes the manufacturer would recommend that it is taken with some oily-based food or maybe some watery food, that is water-based food. This is to help with the absorption of the medication to ensure that the medicine is absorbed totally or to the percentage that the body will be able to use for the intended outcome that is expected. And so for some of them, we would ask you to take it sometimes in the morning, sometimes late at night. But when it comes to before meals and after meals, it's simply this, that we want it either in the absence of food or in the presence of food to aid with absorption. Thank you. With the second question, that has to do with the myth with the BP medications and then the effect on men when it comes to impotence. I also mentioned during my presentation that medicines work in varied ways, and so we have main effect and we have side effects. Most times, clinicians and of course pharmacists are interested in the main effect. Sometimes even the side effects may be the reason why we put some patients on some medication. But regardless, these side effects, so the main effect is what we are actually looking forward to. If we are giving you an anti-malarial, we hope that at the end of the day, you are cured of your malaria. But then, associated with it could be, this is just hypothetical, it could be a headache, or it could be tummy upset, or it could be dizziness. These are some of the side effects. Some are tolerable, some are intolerable. When it comes to some classes of BP medications, because they are working on the blood that is running through your blood vessels as is pumped by your heart through the body, the places where they act, I'm trying to be as lay as possible, the places where they act or where the medicines react to cause the effect could be varied. And so there's the possibility of this medication causing I like the side effect that came. So then, anytime we are giving these medicines, we weigh our options. Is it going to benefit the patient or is it going to put the patient at risk? And then when we weigh the options to benefit to risk ratio, do we withhold the medicine because of the side effect? Or do we give it and give something to help with the side effects? And so, my dear listener, our aim is to cure you. Our aim is to manage your basic condition. Of course, there might be side effects, and these side effects have medicines that can remedy them. If it is non-tolerable or you don't want it, speak to the pharmacist or give feedback to the prescriber. There are varied options that can be used for you. And so don't be scared of the impotence, and because of that, don't take your medication, because then you are at risk of developing complications that could ultimately lead to death. So please come, let's have that conversation. If there are options, we would let you know. If there are no options, we would still let you take the medication, and give you something to help with the impotence. Thank you.
Okay, thank you very much. So, thank you very much, Famanji. So, on her last point, there are still options, alternatives to help you. So, if you're a male and then you are scared of erectile dysfunction whilst taking your blood pressure medications, there are options which can be added to your blood pressure medications so that you don't lose your power or your potency. So, Farm Collins upon, I think our compounding unit is very unique, a unique role that we play. So, I need to ask you this question that we do get sometimes. You'll be there, somebody will call you, my child has a cold, and then a cold with maybe some discharge, the child coughs, and then there's some discharge and all that. So all that is directing to is that probably is an infection or something. So they will ask you that. I have maybe, okay, from your graphics, your illustration, you use Akusia as a little child, right? Belinda, sorry, okay. So Belinda was our patient then, and then the pharmacist, after the doctor or the prescriber had issued a prescription, we didn't have the pediatric or the child dosage or medication. So she had to be taken to the compounding unit, and then the compounding pharmacist will make what tailor-made or personalized medicine for the child. So this question, I want to find out for Belinda. Belinda has a condition, and the only medication available is a tablet, but she can't swallow. She can't swallow. Is it not just okay to crush it in and maybe juice of your preference, of your choice, or just water and administer to Belinda? Because probably it's the same medication that has been written by a doctor, but in this case, we don't have the liquid form. It's only the tablets that we have. So our compounding pharmacist, Farm Collins upon, is it not just, I mean, doesn't it make the work simple? Just crush the adult form that you have and give it to your little girl. What do you have to say to this?
All right, thank you very much from Tony. I think your question is similar to what my friend from Evelyn asked. Yes, so when it comes to crushing of tablets, first of all, we have to find out whether the tablet is on the list of do not crush tablets. Because as pharmacists, per our practice, we know there is a list of do not crush tablets, which lay mother or auntie in the house wouldn't know and may feel every tablet can be crushed, but not all tablets can be crushed by how it has been designed. Some are designed to release slowly, some are to work in a certain way. So if you go ahead to just crush, you are going to just destroy the tablet altogether. So it is advisable that you seek expert opinion from the pharmacist before you go ahead doing that. Also, you need to take note of the strength of the tablet you are going to crush. Probably the tablet you have is 10 milligrams, but your child needs 6 milligrams. The doctor has written 6 milligrams for the child. How is my lay mother in the house going to get that 6 milligrams from the 10 milligram tablet? That one is something technical for the pharmacist to do. We know how to go about it. And also, some tablets are bitter. So if you are just going to use water, trust me, the child is not going to take it. So as pharmacists, we know what to do to make it palatable, to make it elegant, and for the child to take the medicine. So always come to your pharmacist. We are always around to help. Thank you.
Okay, thank you. So before you put your mic down, take this one too. How do you ensure, like, you to get the right dosage? The prescription has been written, but it's for a pediatric patient, a child. How do you ensure that you convert from the tablet to the liquid dosage form? How do you ensure the calculation that you get the right dosage? So quickly, we have some interesting comments and questions from our online audience. So quickly, Farm Collins upon, could you take that? How do you ensure that you get the right dose when you are converting from a tablet to a liquid?
Okay, so it all has to do with calculations, and that's our domain. So when it comes to the calculations, first you look at the prescription you have. So what does the doctor want for the patient? And then we have our calculations that we do. It's our domain, so we know what we do. So we do the calculations to know the number of capsules or number of tablets we will use. So we'll then take that number of tablets, and then we have a way of converting it into the syrup. So that one is in volumes. So are we going to do it, let's say 2 milligrams in 2.5 mils or 2 milligrams in 5 mils? That one, when it comes there, we look at the age. There are certain SOPs we follow, and then we take the right decisions and make sure that at the end of the day, we are giving the best for the child. Thank you.
Okay, thank you very much. Well explained. So, last reminder, we are still live. Coming live from the Obs and Gynae Conference Room, Korle Teaching Hospital, the Korle Webinar Series, August edition. Valuable audience online or our social media handles. We value and appreciate you for your time and then your participation. Keep your questions and comments coming. And this program is facilitated or made possible by the management of Korle Teaching Hospital and organized by the Public Relations Unit. So a quick one, we have some questions, so some comments. Okay, so let me call out, I have my auntie here. She says, brilliant presentation. I have to Auntie Sedina. Auntie Sedina, thanks for joining us. So I've called out my auntie. She's live with us. Okay, so the questions are interesting here. So from our online audience. The first one says, hello, how do you advise a patient to take polypharmacy? So polypharmacy, for our audience and participants, polypharmacy has to do with, we have quite a number of drugs on a prescription, more than 3 medications on a prescription. Sometimes you could have 5, you could have 6, depending on the patient's condition or the medical condition or characteristics of the patient. So how do you go circumvent or handle polypharmacy? So I think Farm Angela will do justice to that. I'll read the next one. So, Farm Angela, kindly take note with the polypharmacy. Okay, so the next one says, okay, I think this one is it giving us information or something? Okay. So please, is it true that nifedipine can help with severe hiccups? Nifedipine is a drug which is used in management or control of blood pressure. It has other uses. And then for purposes of education, with medications, we have something we call the official use or official indication as official use. But because of how the medications work, they can also be used for what? Other purposes as well. A case in hand is the story of sildenafil, Viagra. We know that Viagra is very, very common. I'm using that as an example so that we can all relate. Viagra is used for male erectile dysfunction in adult males. But with the origin or the history of the development or the manufacture of the drug sildenafil or Viagra, it was originally developed for use in a condition known as pulmonary hypertension, which occurs in pediatric populations in children. But then the case is rare, it's not too common. So economically, it wasn't viable for the manufacturers. But because of how the drug works, you realize that it can also help in what? Correction of erectile dysfunction in male adults. So our audience who sent us, he wants to know whether nifedipine can be used for hiccups. I don't know if anybody, I'm a medicine information pharmacist, but this is news to me. And then medicine is dynamic, it evolves. So we have new information every now and then. So maybe I appreciate this question. So the handle is Maria Muhammad. So Maria Muhammad, thank you for this question. We'll look into it and then we'll update you on our platforms. We'll find out whether nifedipine can be used for hiccups as well. So back to Farmanji, how do we handle his use of polypharmacy? You have a list of drugs, multiple drugs on a particular prescription, because we anticipate that there could be potential drug interactions and all that, incompatibility. So how do you navigate as a pharmacist, or how do we handle some of these challenges? Thank you.
Thank you so much. Before I delve into the answer properly, I would want to assume that the polypharmacy is actually audited and validated, in the sense that there are some people who may be on certain medications at home, taking routine medications and might be prescribed with newer ones. And so it is for us to do the medicine reconciliation to be sure that currently the patient is supposed to be on those multiple medication. And so granted that the patient currently has to be on about 3 or 4 or 5 medications at the same time, then we go on to find out the timing for the medication. Is it once a day, twice a day, 3 times a day? When that is confirmed, then we'll also want to find out whether they are supposed to be taken before meals or after meals, and then would outline how these medicines are supposed to be taken. And indeed, this is done at the medical pharmacy for patients on discharge, where a discharge sheet with the medications are written on with the special instructions on how to take them. Again, we have medicine aids. I believe when I was doing the presentation, I mentioned that we have medicine aids that also are dispensed from the pharmacy. One of them is what we call the pill organizer, or some call it the pill box, where we have the 7 days written on the box, and then it has different sections for the various days. So then the expert or a caregiver who has been trained be able to help you organize your medicine so that we'll be able to separate for you the ones that are supposed to be taken only in the morning, the ones that are supposed to be taken only in the afternoon, the ones that are supposed to be taken before meals and after meals. These instructions will be given to you because whether you like it or not, you may be at one point in time in need of several medications. But like I said, understanding your therapy is very important. If you get to know why you are taking the medicines, then you'll be able to appreciate why you're supposed to be taking 3 or 4 medicines together, because they may be doing different things concurrently to help with your health care. And so the organizer or the pill box, as I mentioned, will be one of the good ways for you to be able to organize them to know. Sometimes we'll be able to tell you about how to take them, even though you are taking 2 or 3 together. Some could cause interactions. And so with these drug-drug interactions, we'll be able to tell you that when you take this one, wait 30 minutes or up to 1 hour before you take the other one. Or we'll be able to tell you that when you take this, it may cause this, and so hold on with this and take it an hour after. The same comes with eye drops or eye preparations. Sometimes you may be given 2 or 3 preparations. How do you know whether you are given the sterile drop first before the suspension and then the ointment, and then the timing interval? These information are very specific to specific medications, so talk to your pharmacist and be able to tell you exactly how to go about your polypharmacy. Thank you.
Okay, thank you very much, Angie. Well explained. Thank you very much. Okay, I think we have, this should be our final, so our acting director of pharmacy, Family Tankusi, you may go ahead with your question or comment.
This is just a contribution.
All right, good.
And we're talking about formulations for children. I just want the general public to understand that children are a totally different clinical population. There are so many times that we just take children as small adults or mini adults, but their systems are totally different from the adults. So we should be very careful with self-medication. And anytime you have issues relating to children, let us make sure the right professionals handle them. The second thing is to assure my man, sir, you didn't mention your name, but the systems we have at the manufacturing units are standard. Okay, the facility is approved. We have the right caliber of staff handling it. And then the machines and the equipment that we use are all well calibrated. Some are calibrated by the Standards Board, FDA, and so the assurance is there. It's perfect. Thank you.
Okay, thank you very much, Family Tankusin. So, as we very soon we're going to bring our session to a close, but we have some comments and questions from valuable online or social media participants. So I'd like to read them. So okay, so this is coming from, the handle is Ekubov Empire. Okay, limited. So good afternoon, everyone. He's saying that what medicine would you recommend for a common headache? And are there any side effects I should know about? So I think I'll address this one personally. So Ekubo Empire, the pharmacist is your friend. When it comes to issues of medication use, talk to your pharmacist. We cannot sit here and tell you that go and take this medicine A or medicine B for your headache. Talk to your pharmacist. The pharmacist is your friend. I think I missed out something. Our motto in Latin is Amicus Humanis Generis, which is translated as friends of the human race. So the pharmacist is the first point of call when it comes to healthcare. Talk to your pharmacist. If it's beyond your pharmacist, he's going to make what? A referral as well. So talk to your pharmacist. If you have, don't just assume that it's common headache. Probably it could even be a side effect of what? Having elevated blood pressure. So if you're having headache, talk to your pharmacist. It could be anything, and then you could be assessed properly. Thank you. Okay, so we're bringing our meeting. Okay, so we'll draw the curtain. We'll bring the meeting to a close in a bit, in a moment. But before we do that, I'll take my able panelists here will give us their final words, probably, let's say, their overarching message. Because we've seen this afternoon that beyond just dispensing, pharmacies do what? They create medications which are not readily available for special populations or groups. Also, we've realized that our role has expanded and we are a key member of the healthcare delivery where the patient is the center. So I'll go back to our panelists, able panelists, and they'll give us their final words, the overarching messages, what they want you to take home as well. So I'll start with Pharm Angela. So Pharm Angela, please do us the honors. What's your final words, your wrap-up words? What you want your audience to take home with?
Thank you for this opportunity. As pharmacists, we are your friends. We are here to help you with your medication needs. Pharmaceutical care is what we are all about. We do not work in isolation. We work with a multidisciplinary team. We work with doctors, we work with nurses, lab technicians. Every one of us are involved in your healthcare. But when it comes to your medicine needs, we are the experts. Never shy away from talking to the pharmacist. Indeed, if you come to the hospital, never leave without talking to your pharmacist, because you may have some medications you are taking along with you to the house. How you will take it, why you are taking it, is it even for you, and what benefits and risks are involved. So we are here for you. We want you to understand all these things because, like the Bible always says, understanding is important. In all you're getting, get understanding. It says wisdom is a principal thing. So get wisdom, but in all that you're getting, get understanding. So understand your medicines, understand the role of pharmacists, and know that we are here for you. Talk to us, give us feedback, and we are willing to serve you to the best of our abilities. Thank you very much.
Okay, brilliant. Farm evangelist, Dr. Hatchfield, brilliant. Okay, so from Collins.
Okay, so I would like to thank each and everyone for making time to join us, both in person and online. I'm sure today's session has been informative, has been enlightening. So to end, I'll say drug manufacturing, our doors are always opened. You can always come and let's have a discussion on how best we can help you or your patient. That's if you're a doctor or if you're a parent, how best we can help your ward. Thank you very much.
Okay, thank you very much. So briefly, our deputy director in charge of clinical has something small. So quickly, do it snappy for us, Dr. Ibn Sana. So quickly, we'll take.
Yeah, thank you very much. I think all I wanted to say is that I wanted to commend the team. This is our maiden edition. I am sure that in our subsequent ones, we would improve more. But this is our maiden edition. I just wanted to say to what Dr. Angela and Paul did that pharmacy has now developed right from the dispensary. We now have specialization in all areas, renal, others, clinical, public health. So we do more, and we are all part of any clinical team within Korle. So that's all that I wanted to add. Thank you very much.
Okay, thank you very much. So we'll bring this session to a close. I'd like to thank the Almighty Lord who gave us a mind to be here and share this with you. I would also like to thank, even though he's absent here, our Director of Pharmacy, Dr. Charles Ofe-Pam, who also made sure that he facilitated, he supported, and made sure that this happened as well. I'd like to thank Korle management team, the PR section as well. I'd like to thank our core management, senior members from the pharmacy directorates who came here with us. I'd like to thank our valuable participants or audience on our socials or online. And those of you who also were able to make it in person here, I'd like to thank you very much. So on my signing note, I'll say that the pharmacist is your friend. And then when it comes to issues of medication regarding your wellness, talk to your pharmacist. If you come to the hospital or you are sick and you don't talk to your pharmacist, there's a new slogan going on, "Wechi ede, wechi guo." So thank you very much for coming.
Catch me on the 27th of August at the Ops and Gynae Conference Room or our socials, Facebook and YouTube at Korle Teaching Hospital. So make a date, don't be late. Tell your friend Kate.
Did you know a pharmacist was also referred to as apothecary in ancient times? And that description just referred to a compounder, a formulator of medicines, and also a dispenser of medicines. But with contemporary times, the profession or the practice has evolved, and we have what we call the pharmacists now. My name is Pharm Antonio Say with the Medicines Information Unit. Patient care involves a multidisciplinary approach where we have the doctor, we have the pharmacist, we have the nurse, we have the nutritionist, we have the physiotherapist, the biomedical scientist, and other cadres. So join us on Thursday, 27th of August on our socials, YouTube or Facebook at Korle Teaching Hospital. The time is 3 p.m. or you can come in person to the Ops and Gynae Conference Room where we delve into the topic from the dispensary to the patient, the pharmacist's touch. Tell a friend or share the link and don't miss out.
There's a story I heard about a woman who went to the hospital and having waited for so long